Hi, I'm Rita Williams. I'm a nurse practitioner with PeaceHealth Pulmonary here in Vancouver, Washington. I want to welcome you to our COPD program. This program was put together to help patients with COPD learn about their disease, how to manage it, common treatments, how to recognize when it's getting out of control, and what to do to get it back into control, and hopefully avoid emergency room visits and hospitalizations. Let's get started. So this is an overview of what we're going to talk about today. First, what we're going to do is we're going to define what COPD is and what is an exacerbation. We're going to talk about how to prevent those exacerbations, what the common treatments of COPD are, how you can live better with your COPD, and when you should call your health provider. And at the end, we'll kind of review everything just to kind of give you an idea of the highlights to remember. Starting with the definitions. So, COPD stands for Chronic Obstructive Pulmonary Disease. So chronic means that it's all the time. Obstructive means that it's hard for the air to get out of your lungs. Pulmonary means that it's your lungs. And disease means it's a constellation of symptoms that we recognize as being a diagnosis. There's different types of COPD. One of them is chronic bronchitis. There's that word chronic again, meaning all the time. Bronchitis means inflammation of the airways. And the symptoms associated with chronic bronchitis are generally a cough that just never goes away, and it's on most days of the week, most weeks of the month, and most months of the year. And the cough is frequently associated with mucus production. The other type is emphysema. Emphysema is where the air sacs at the end of your airways either collapse or are disintegrated. The most common cause of emphysema is smoking. The nicotine is what destroys these air sacs. The diagram over here shows the word COPD, but these circles represent three different types of obstructive airway disease. You'll see the emphysema and the chronic bronchitis, but then you also see asthma. Asthma is a third type of obstructive pulmonary disease, but the difference is with asthma, it's not always active and it's also reversible using short-acting bronchodilators, meaning it opens the airways up and then the airflow is normal. We don't see that same airflow improvement with chronic bronchitis and emphysema. But what the diagram is showing you here is that each of these diagnoses can exist individually, or they can overlap with any two combinations, or a person can even have all three. So what's an exacerbation? Exacerbation is just a big word for meaning things are getting worse. So it's a worsening of your daily symptoms, more short of breath, coughing more, increased mucus production, or wheezing. Usually these symptoms require additional therapy beyond what you would normally do every day. And the biggest predictor that you're ever going to have a COPD exacerbation is that you've had the first one. So with this class, we're hoping to help you gain control of these exacerbations so that it helps to decrease when you're going to have that next one. Most of these exacerbations are associated with infections, and we're going to talk about how you can avoid infections and hopefully avoid the exacerbations. So one of the ways that you can avoid an exacerbation or to manage them is by, of course, avoiding infections, staying out of extreme temperatures, so the very cold and the very hot, as well as avoiding poor air quality. And that also means if you smoke, you're kind of your own poor air quality. So stopping smoking is probably the number one best thing that you can do to help control your COPD. Signs that you're having an exacerbation include a change in the color of the mucus that you cough out, or even the amount that you cough out. If your cough becomes more severe or more frequent, if you have increased shortness of breath or wheezing, And then also cold and flu symptoms. And again, that's usually because a lot of these exacerbations are associated with infections. So a cold or flu can start an exacerbation. How you can monitor your symptoms is with a COPD action plan. This is an example of an action plan, and you'll notice it's got 3 different areas. You have green, which is when your symptoms are in good control. You have the yellow zone, when you're starting to get some of those symptoms of an acute exacerbation, that increased cough, mucus production, more shortness of breath, or wheezing. Red zone is when things are basically out of control. We don't really want you to get to the red zone. This is when you end up in the emergency room or you get hospitalized. What we want to do is catch things early in the yellow zone so we can turn them around very quickly and get you back into your green zone when things are controlled. One of the things about the COPD action plan, not only does it help you track your symptoms every day, but it also can help guide you in what you can do to manage your symptoms. So how do we prevent these exacerbations to start with? As I mentioned earlier, the best thing you can do is to quit smoking. And there's a lot of different options to help you to quit. We have websites here. We have a website here at PeaceHealth that you can go to and look about the resources that we have here about classes or other assistance. Online, there's websites such as quitline.com, onebreath.org. These are smoking cessation websites that have information on how to track how much you're smoking, how to cut down, how to avoid your triggers, and options on helping you quit. There's also the state line called Tobacco Quit Line, or 1-800-QUIT-NOW, and there they have counselors, and sometimes they can even provide you with free supplies of nicotine patches. Medications to help you quit include the nicotine replacements, such as the patches, nicotine gum, or lozenges, and that definitely has helped people to quit. Other options include medications such as Wellbutrin, which you may know as an antidepressant, and we discovered that treating patients with depression who were smokers, they tended to cut down and quit their smoking when they were started on Wellbutrin. The other medication is called Chantix. Chantix was specifically designed to help people quit smoking, and out of the options has the highest success rate of staying quit. I encourage you to talk with your provider about the different options to help you quit smoking, because it is the #1 best thing you can do. Remember I said that most of these exacerbations are associated with infections, so we need to know how to stay well and avoid illness. So one of the important things is to remember each fall to get your flu vaccine. It's not a live virus, so you cannot get the flu from the vaccine. You can develop flu-like symptoms, and that's just your body responding appropriately to the vaccine, and sometimes it feels like the flu, but you don't have the flu, and you cannot give it to someone else. But it definitely helps. It takes a couple of weeks to really start those antibodies going, and about 6 weeks to have its full benefit. So remember to get your vaccine, preferably around October, so that you have the best protection by the time the flu season starts, which could be as early as December. You repeat it every year because the virus does mutate, it changes, and so every year we have to adjust the vaccine just a little bit to respond to those changes in the virus. The other vaccines are your pneumonia vaccines, and there's 2 of them. There's Pneumovax, which you get once before you turn 65 years old, and then one more time after you've turned 65 years old. The current guidelines from the CDC recommend these 2 vaccines, or 2 doses of the vaccine, and once it's given after 65 years old, does not need to be repeated. The other vaccine is Prevnar 13, and the current guidelines say you get this once after the age of 65, and once it's given, no further updates are recommended. Other things that you can do to stay well, of course, is to avoid sick contacts. You can do this by asking people that are not feeling well to not visit you until they're feeling better and don't feel like they're contagious anymore. Avoid crowds where there's the potential of getting exposed to people that are sick. This also means when you make your appointments with your providers, you might want to choose times that are less popular, so that way you have less exposure to people that may potentially be ill. If you are out in the public, I encourage you to wear a mask, and this can help protect you. Not only does it protect you against potential people that are sick, but also they look at you and think maybe you're sick, and so they're going to stay away, which is not a bad thing. And then also, you want to address your allergies. We don't really think of allergies as being an illness, but it definitely can make you feel bad, and it can cause an exacerbation of your COPD. So part of controlling your COPD is also controlling your allergy symptoms. So talk with your provider about the different options that are available to you to do this. And of course, washing your hands. And I can't stress this one enough. Using soap and water and washing your hands really well. Sing the happy birthday song a couple of times while you're washing, and then sing it a couple of times more while you're rinsing, because you can do all the washing in the world, but if you don't rinse it off, it's not quite as effective. Hand sanitizer is another option when you don't have access to soap and water, but make sure you use plenty of it, and you rub it on both sides of your hands and between your fingers until it's completely dry. And don't touch anything until it is dry. So another diagnosis that can trigger a COPD exacerbation is called gastroesophageal reflux disease, commonly known as GERD or heartburn. The way our body is designed is that our airway and esophagus kind of sit side by side, and so when contents in the stomach come back up into the esophagus, they run the risk of flashing over into the airway and irritating the airway. When that happens, you can have coughing, wheezing, or shortness of breath because of that irritation. Other signs of reflux or heartburn, of course, include the traditional heartburn, so a burning sensation in the chest near where the heart is, as well as a burning sensation in the throat from where it came up into the esophagus. Definitely GERD can cause exacerbations of your COPD. So you want to talk with either your primary care provider or your pulmonologist about options of treatment. There's a variety of medications that are out there to help you. There's also things that you can do, like avoiding eating or drinking any liquids, including water, for about 3 to 4 hours before you go to bed at night, so the stomach is as completely empty as possible. An empty stomach is less likely to reflux. The other thing you can do is elevate the head of your bed, putting blocks under the head of the bed so the whole bed is lifted. That way, no matter where you slide, your head is always elevated. Avoiding foods that you know trigger your heartburn. And then some of the foods that are more commonly known to trigger heartburn or reflux include things like spicy foods, alcohol, caffeine, and even smoking will help to relax that valve between your esophagus and your stomach and lets the contents come out. So again, there's smoking, good reason to quit. A couple of other diagnoses that have been associated with increased COPD exacerbations are anxiety and depression. We found when either or both of these diagnoses are associated with a diagnosis of COPD, that these individuals have more exacerbations. Kind of makes sense, because when a person is short of breath, they start to feel more anxious, and then as they get more anxious, they become more short of breath, and it can just trigger that whole exacerbation. And I definitely have had patients who are never sure if it's their anxiety or their COPD that's triggering their difficulty breathing. The other option is the depression, where sometimes when people are depressed, they don't want to take their medicines. And if you don't take your maintenance inhalers with your COPD, you're going to find that your COPD will get out of control. There's various medications that are available for treatment of both anxiety and depression, and I encourage you to talk with your primary care provider about it. There's various self-rating scales that you can do, which are questions that your primary care provider can look at your responses, and they can look and see if you're at risk of either anxiety or depression and decide if treatment is recommended. The treatments can take a little bit longer, and just make sure you follow up with them so they can make any adjustments to the doses or maybe even adding a different medication. So regular follow-up is really important. So as I mentioned earlier, that the whole anxiety and shortness of breath has this relationship. A lot of times what triggers it is a stressful event. And what this diagram over here shows you is that you have the stressful event, and that leads you to start to feel more short of breath. And as you become more short of breath, then you can start to feel anxious. And that anxiety makes you breathe even faster. And as you breathe faster, the muscles that you use for breathing actually start to fatigue. And as they get tired, that makes you more short of breath. And then as you're more short of breath, of course, you get more anxious, and it just keeps going until those muscles fatigue and you panic. And that's generally when people are calling 911 or going to the emergency room. So what we encourage is that you try to do things early on to make these symptoms get back in control. So in this area here is where you want to use some of these techniques. And everybody has their favorite thing that helps them feel relaxed. For some people it's yoga, others it's prayer or meditation, or maybe even just listening to calming music. One of the things you can do is use some progressive muscle relaxation, and that's where you kind of start at one end of the body and you tighten up those muscles really tight, and then you consciously relax them, and then you just move to the next muscle group and squeeze that one really tight, consciously relax, and work your way down the body. And most of the time, by the time you get to the other end of your body, you're feeling more relaxed and you're breathing more easily. Other things that you can do are also some breathing techniques. Belly breathing is one of them, and we're going to talk more about that technique later. Also, I like pursed lip breathing, and I encourage my patients to use that. And that's where you pucker your lips really tight, almost like you're going to whistle. So you breathe in through your nose and then exhale through those pursed lips, and it's kind of a longer exhale, and it just helps you to get better control of your breathing and helps you to relax. So common treatments. My partner Keith is going to talk more about these right now.
My name is Keith Jackson. I'm a respiratory therapist here at PeaceHealth Southwest, and I'll be discussing the common treatments. The largest treatments that we're going to use are primarily COPD medications, and they come in two varieties. There's maintenance inhalers, rescue inhalers. Maintenance inhalers don't work very fast, but they work long and steady. With maintenance inhalers, you'll take them once a day or twice a day, depending on the medication and depending on your doctor's direction. And that should be done whether you're feeling really well or whether you're feeling poorly. In between times, you'll use rescue inhalers. Rescue inhalers kind of bridge the gap between your doses of your maintenance medications. And we'll talk about on the next slide the review of correct inhaler usage. It's important to note that sometimes people have cost issues with their inhalers. It's important to not take no for an answer, but to discuss with your doctor the problems you may be having with insurance coverage. They have coupons available, they have samples, and sometimes the pharmacies and the insurance companies will have an insurance or patient assistance program to make sure you get your medication. Regarding the inhalers, anything that sprays out like this requires a chamber like that. If you look at the diagram, patients that just use the inhaler without the chamber like that get most of the medicine in their mouth and throat. They get about 30% of the medicine here. If they use a chamber, they get about 75% of the medicine in here. The way they use the inhaler is to shake it up for about 5 seconds. There's two things in there. There's the propellant and the medication. We want to mix those. The cap comes off. That goes inside this little chamber. You get a puff and then a slow, deep breath. You hold your breath for 10 seconds. And let it out. Usually these have 2 puffs per dose. You want to wait 60 seconds before doing the next puff. There's a chamber inside that needs to fill up, and if you don't wait the 60 seconds, you only get a half of puff or less. The reason we use a spacer is because this stuff sprays out so fast that it hits your throat. And if I spray, I'm actually feeling that on my hand there. So use your rescue inhaler when needed. If you're using it more than every 4 hours, it's time to call your doctor. And some of the other things that we use is oxygen therapy. About 30% of our people with COPD will eventually need oxygen. It will improve their life. It'll improve the length of their life. But they have to use it correctly. There's a light that shines through the finger on an oximeter, and you can get these at drugstores and online retailers. The light is red on the bottom side, and it determines the color of your blood. The redder the blood, the more oxygen. The bluer the blood, the less oxygen, and it'll read out on the monitor. But this only works if you've got your fingers nice and warm. If your fingers are cold, the blood doesn't flow through very well. Also, obstructions such as fingernail polish will interfere with the device, and so you will not get a correct reading. When you have oxygen, sometimes there's the temptation to turn it up more and more, like more was going to help you feel better, but that's not the case. We want to keep it in a narrow range of 89 to 92%. That's the sweet spot. And so using oxygen correctly will help you with your COPD if you need oxygen. One of the other treatments and therapies for COPD is pulmonary rehab. And I need to kind of point out this is not pulmonary rehab. This person is on a treadmill booking it pretty hard. Usually we're talking about gentle exercise with pulmonary rehab. You're monitored by a respiratory therapist, by a nurse, and exercise physiologist. It's a structured program for people with chronic lung disease. You develop a little bit of endurance. You don't get brand new lungs, but you're able to do more with what you have. They also have education classes that focus on lung disease, breathing techniques, diet, smoking cessation, and more. Those people who do pulmonary rehab are the ones that have a better chance of staying out of the hospital for COPD. We also stress good nutrition. We want you eating several small meals per day rather than a large meal. The stomach, when it gets very full, will push up against the diaphragm, making it very difficult to take in a breath. So we want you to eat slowly and then stay well hydrated to thin out the mucuses inside your lungs. So to live better with COPD, much of this is going to be pacing yourself throughout the day and breaking up your tasks. For example, if you need to make your bed, you make half of it, take a break. Make the other half hour later. If you're doing the laundry, just simply getting the laundry into the laundry room and then take a break. Things like that. So pace yourself, break up the tasks, move slowly. You don't have to do everything fast. Just keep moving. Sitting for a task such as putting on makeup and getting dressed for brushing teeth can help you with COPD so that you can do your daily activities without getting so short of breath. It's important to arrange your house so that the things you need to get to are available. You don't want the things that you're going to use every day in a spot to where you have to climb a ladder or a step stool. Keep it down where it's convenient. After meals, take a rest for 30 minutes before you do anything else. If you're planning on taking a shower or doing a bit of gardening or some housework, wait 30 minutes after the meal so that you can do your job better, your activities better. Shower stools with a hose for bathing are very helpful for people with COPD. They become less short of breath from all the mist and the warmth in there in the shower and are able to do that job better. Assistive devices such as long-handled reachers are helpful. There are devices to help you put on your socks without bending over. Those are all helpful with people who have COPD. Carts with wheels to push oxygen tanks or to push things that you want to carry around. Take the strain off of you. Some of the exercises we use are pursed lip breathing. Pursed lip breathing means you just breathe in through your nose to condition the air. Then you squeeze those lips together like you're blowing bubbles. And you want to blow as long as you can. What this does is it helps open up the airways that are collapsed down inside. They plump up, and then you can exhale the air long and steady. And as you blow all that air out, eventually you're going to be able to get another breath back in. and this makes it much easier to breathe, and your brain knows that you're starting to get more air in, and so you'll start to relax. Tripod breathing is another activity, and it can be done with the pursed lip breathing. And tripod breathing means you're leaning forward, you've got your hands on a table, you've got your hands on your knees, kind of like athletes after they break the tape and win a race. You can put your hands on a table, but this kind of moves you forward, moves your stomach away from your lungs so that you can breathe easier. And you could do that with pursed lip breathing at the same time. With abdominal breathing, we want to use the most efficient muscle available for breathing, and that's the diaphragm. So when you breathe in, your belly should pop out. And it's not very sexy looking, but it's very helpful because it's effective. This picture shows a lady with a hand on her belly, a hand on her chest in this manner. The hand on the chest should not be doing the moving. The shoulder muscles aren't that effective for helping us to breathe. So breathe with the belly, and you'll do yourself some favors and assist your breathing. A huff cough is helpful. When we have COPD, there's a lot of coughing that needs to go on, but if you're already short of breath, you're kind of caught between a rock and a hard spot. So most people cough by closing their throat, which is kind of difficult and takes a lot of energy. If you'll do a huff cough by not closing your throat and just blowing the air out fast and steady, you can do a cough that's much less effort. And now Rita will talk about when to call the doctor.
Thank you, Keith. So now let's talk about when you should call your doctor. So here's some tidbits on when you should call them. If you're feeling more short of breath than usual, not a bad idea to call. Now, how do you know that, right? So you're using your COPD action plan that's helping you keep track of how your symptoms are doing. Are you getting into that yellow zone now? Are you also maybe using your rescue inhalers more frequently? That's another clue that you're more short of breath. Listen to your family as well, because a lot of times they'll notice that you're more short of breath with some of your activities that normally don't bother you, but you may not realize it because you live with your symptoms every day. And we know that they have good and bad days. But sometimes the people around you will notice when they're lasting a little longer than usual. If your cough is getting worse, so either it's more frequent or it's more intense, that would be a good time to call your provider to get some additional help, especially if it's not responding to your rescue inhalers. If you have trouble with getting your mucus out, or you're coughing even more mucus out than usual, again, this is another sign that something's out of control and it's good to call your provider. If you ever cough up mucus that looks like it has blood in it, that's a given. Definitely call your provider about that one. We'll figure it out. If you get those flu symptoms, that achiness, the fever, chills, body aches, definitely call us sooner than later on that one, because within 48 hours, we can actually give you medications, if it's the flu, to help shorten the course and to make the symptoms less severe. It's not always the flu, but at least we can catch things early and start treatment, so definitely call us. If any of these symptoms are making it difficult for you to sleep, because the cough is waking you up, or you're waking up in the middle of the night feeling short of breath, having to use your rescue inhaler or your nebulizer, definitely give us a call. It's time for us to step in and give you more help. Again, follow your COPD action plan. If you don't have one, I really encourage you to talk with the person that treats your lung disease about setting one of these up. It definitely can help you keep track of those symptoms that come and go every day, good days, bad days, and help you keep track on how long those bad days are going on. And also, it gives you some guidance on what to do when symptoms are in the yellow zone. Just a reminder, okay? And usually the recommendation is to call your provider within 24 to 48 hours when these symptoms start. And if they're not getting better within that time, you should call to get more help from us. So let's review. What are your exacerbation symptoms? What are the ones you're looking for? So you're looking for more shortness of breath than usual. Activities maybe that make you short of breath normally are actually making it even worse. You can't walk as far. You can't do the things you normally do. If your shortness of breath is waking you at night, that would be a clue that something is brewing. If you're coughing more, you might have a cough every day, but if you find that the cough is becoming more intense or it's more frequent or keeping you awake at night, you need to call your provider about that. If the mucus that you cough out has changed, if it's changed in color, consistency, amount, and especially if you can't get the mucus out. Wheezing, that's another sign of a potential exacerbation. Some people have some wheezing occasionally, but they may cough or use their inhaler, it goes away, all is good. But if you find that you're wheezing more and not getting the relief that you normally get, you would definitely want to call your provider for that. How do you prevent your exacerbations? Well, one of the best ways is to protect yourself from getting sick. So stay away from the sick contacts, use a mask when you're out in public. You can also keep your immunizations up to date. And again, remember, the flu vaccine and pneumonia vaccines are not live viruses or bacteria, so you can't get the illnesses from either of those vaccines, but they're very important in protecting you from getting those illnesses and keeping you out of the hospital. The flu vaccine is every fall. Get it early enough, generally around October, so your body has time to build up the immunity for when flu season starts. And pneumonia vaccine, there's two. Pneumovax is given once before you turn 65 and one more time after you're 65 years old. And Prevnar 13 is the other one that's given once after the age of 65. Talk with your primary care provider or your pharmacy to get these immunizations. And what are treatments for your COPD? So you have your daily treatments. Those are the maintenance inhalers. Those are the ones that you're going to do every day, regardless of what your symptoms are. Without fail, you always do it. It's just like brushing your teeth. To have good dental health, you brush your teeth twice a day. So same thing goes with your inhalers. Take them as they're prescribed. Some are only once a day, others are twice a day. So just make sure you're taking them correctly and every day. And then you have rescue inhalers, and those are the ones you're going to use when you're experiencing some of these symptoms of an acute exacerbation. They come on very quickly in their effect, but they also don't last very long, where maintenance inhalers will last 12 to 24 hours. So rescue inhalers, you only use them when you need them, and you shouldn't have to use them every day. And remember, treatments include nebulizers, not just inhalers. So what can you do to help to live better with your COPD? Exercise, moving, and that's what pulmonary rehab is about. It's about helping you to move at a level that your lungs can tolerate and to increase the strength to be able to do more. If you're just sitting all day long, that's about all your lungs are really prepared to do. But if you get up and you move, even if it's just taking 10-minute walks a few times a day, gradually you'll notice that your breathing does better with these activities, and you could probably walk even further, and you might not need to break it up so much. You've got to have the lungs prepared to do the activity. So do your exercise, break your tasks up also. You don't have to do everything all at once. If you're making your bed, make part of the bed, sit down, take a break, recover, and then later do the other part of the bed. The bed's still going to be there. Other things that you can do is eat healthy, get enough protein in your diet, make sure that you're well hydrated so that the mucus is thin and easier to get out. All of these things can help you to live better. And if you happen to be one of the patients that use oxygen, make sure you use your oxygen appropriately. More is not always better when it comes to oxygen. There's that certain range of about 89 to 94% is where we want you to be. It doesn't have to be higher than that. All that being said, if it's higher than that and you're not using oxygen, you don't need to make it lower. But if you're using your oxygen, 94 is the max that you really have to have it. And even 92 is acceptable. So just follow the guidelines from your provider about how to use your oxygen. You might use it all day long, or you might only need it when you're doing activity. And what other kind of methods can help you to live better? Well, there's tools, such as there's grabbers so that you can reach things. There's even devices to help you get your socks on without having to bend over. You can use a stool in your shower so you can sit down, or using the hand sprayer, again, so you can sit down and shower, because bathing is actually really hard work. And if you wear your oxygen in the shower as well. These can all help you get through these activities a lot easier. So when should you call your doctor? Well, that relates right back up here to the symptoms of an exacerbation. So if you find that you're more short of breath than usual, and it's not responding or going away with your rescue inhaler, if you find that you're coughing more, either more frequently or more intense, or if you're bringing up more mucus, or what you're coughing out looks different than what you normally cough out, it's changed in color or consistency, or even if you now can't get the mucus out, it's hard. These are all things that you're going to call your provider about. If you cough up blood, call your provider. And if you're wheezing and it just doesn't go away, call us. And remember those flu-like symptoms or allergy symptoms that just aren't in good control? Those can also trigger your COPD, as can reflux disease, anxiety, and depression. So if you think any of those other conditions are not well controlled, definitely talk with the provider that manages those and help them get in control, because that is part of controlling your COPD. Any questions? I encourage you to talk with your pulmonary provider about any questions you have about your COPD and your medications and things that you can do to live better with your COPD. Make sure you have that COPD action plan. That helps you to really keep track of your symptoms every day and know when to call your provider. Thank you. I really appreciate you taking the time to listen to our program today, and I hope that you find the information useful and it does help to keep you out of the emergency room and the hospital.